Hello learners. So the next topic we are taking with the anti-hyperlipidemic agents, the drugs which reduces the lipid content of our body. So this chapter we will deal in two parts. So this is the first part 1, part 2 we will deal the next. So the learning outcome of this chapter that on completion of these two sessions where the learners will be able to define and describe what is meant by hyperlipidemia and how it is leading to the atherosclerosis. So these are the two terms which are associated with each other, hyperlipidemia and atherosclerosis. So you will be able to differentiate the types of lipids, what are the different types of lipid and their clinical significance in our body. You can be able to classify the drugs which are used in anti-hyperlipidemic agent, and you can also predict the pharmacotherapy for the atherosclerosis, that is the complications which is due to the hyperlipidemia. You will be also able to explain the mechanism of various types of anti-hyperlipidemic agents. Hyperlipidemia is nothing but a leading cause of atherosclerosis in coronary artery diseases and cerebral vascular disease. So atherosclerosis means you are knowing very well there is a deposition of a cholesterol inside the coronary artery or cerebral blood vessels. So this is a consequence of hyperlipidemia, a leading cause of it. So there is a raised in total serum cholesterol, low density lipoprotein and triglycerides. So hyperlipidemia means there is an elevation of cholesterol, not only the cholesterol, but along with that, there is another associated accumulations also. There is a low density lipoproteins and triglycerides. Along with the cholesterol level is increased. So combined together, they are also known as it is known as a hyperlipidemia, and which is leading to the atherosclerosis. So it results in this atherosclerosis result in ischemic heart disease, congestive heart failure and stroke in the brain. So these are the outcomes of that atherosclerosis. Dyslipidemia or hypercholesteremia, reduced in HDL level or cholesterol, this HDL cholesterol, these are the main reasons behind the occurrence of the hyperlipidemia. So leading comorbidity is one of the reasons which stimulates this hyperlipidemia. The factor which is responsible behind is the smoking, alcohol consumption, diabetes, hypertension, family history. So these factors actually promote the hyperlipidemia. And the anti-hyperlipidemic agents, these are the agents which we are going to study over here. These are the agents which will lower this lipid level. So total cholesterol, LDL and triglyceride level is lowered, or their progress has been arrested by these agents. So here we will see what are the different types of lipids and how they are oriented or like this way. So the highest type of a lipid over here is chylomicrons. They are having the diameter. The globules are having a diameter of around 500 nanometers, which contains a very high amount of triglycerides. Phospholipid is emulsifying agent actually is very low, and the amount of cholesterol is also low. But the fat content, you can say triglyceride content is very high. So emulsifying agent. So it is oil globules, chylomicrons you can say. So next to it is a very low density lipoproteins. Density is very low, so their size is bigger. It will be bigger. So around 43 nanometer. Triglyceride amount is a little bit lower. Phospholipid is little bit elevated, and cholesterol is significantly high over here. It is obtained in the liver. Then next is intermediate density lipoproteins. They are also little bit dangerous as such the complications are concerned. Diameter is again reduced over here due to catalytic reactions. Triglycerides lowered. Phospholipid is almost all similar to that of VDLD, and cholesterol is also elevated over here. The most dangerous is low density lipoproteins. The diameter is almost same as that of ideal, but the triglyceride is lower and the phospholipid is also same as that previous, but the cholesterol amount has been significantly increased over here. So the amount of cholesterol which is present as compared to phospholipid is very high. So therefore this is one of the most dangerous. and most beneficial is a low density lipoproteins. You can see the diameter is very low, triglyceride amount is very low, the emulsifying phospholipids is very high, although even the amount of cholesterol is significantly high, but this is the one of the major transporter of the cholesterol, so the amount of cholesterol is very high, but the amount of phospholipids is maximum, the emulsifying agent, it is maximum over here, and triglyceride fatty content is very low over here. Moreover, the size of globules is very high, small. So the most dangerous amongst these is the LDL and IDL significantly, whereas the most beneficial is HDL. So HDL is actually working as a transporter of the cholesterol. You can say the amount is very high, but here the LDL is working as a store of the cholesterol. So LDL is a store of a cholesterol, whereas the HDL is a transporter, throwing out of the cholesterol. So here we will see what is the difference between a LDL and HDL, basic difference in between HDL, how the LDL is dangerous and how HDL is more beneficial. So LDL is a low density lipoproteins, whereas HDL is high density lipoprotein. High density means globule size is smaller, so therefore in a unit area it will be having the large amount of globules. So LDL is a result of catalytic reaction of ideal intermediate density low protein in the hepatocytes. In the liver, the ideals are converted into LDL, which is having around the 50 to 60% of the cholesterol and 10% of the triglyceride. And this 50 to 60% of the cholesterol, it is working as a store over there. So it stores that cholesterol. It does not throw it out. Half-life is 1.5 to 2 days. The particle size and number are related to atherogenicity. So it is one of the main reasons behind the generation of atherogenicity, the atherosclerosis. The smaller and denser LDL have the greater chances of the atherogenesis. So it is directly proportionate to the amount of the atherogenesis chances are directly proportionate to the amount of LDL. More will be the LDL, double will be the chance of coronary events. So 1% increase in a LDL level will lead to the 2% increase in a coronary event. So this is one of the, therefore it is one of the most dangerous type of lipoprotein over here. Hepatic receptors like endosized LDL, they are incorporating into the lysosomes and eliminated in the bile, so cleared from the body. So 70% LDL will be cleared by the hepatocytes. So deposition of this LDL into the hepatocytes are more important. They are catalyzed over there, they are stored over there. It acts as a store for the cholesterol. On the other hand, high density lipoprotein, these are the beneficial for our body, they require. They are synthesized in the liver and intestine. They are not catalytic reaction. They are synthesized in the fragmentation of chylomicrons and very low density lipoproteins. So they are synthesized over there. HDL is a vehicle for transport of cholesterol and from the peripheral tissue to the macrophages for the elimination, for degradation and throwing out. LDL working as a stored, HDL working as a transportation for the excretion. HDL is a scavenger for a cholesterol, although it contains around 41% of the cholesterol, but it is a scavenger, and due to its scavenger activity, it is working as a, it contains the high amount of a cholesterol. Increased HDL is a less coronary events or atherosclerosis, and decreases coronary events it will be. So increase in HDL is beneficial for our body. So due to increased LDL, there is a less coronary event we can say, or there is a deposition of our cholesterol or atherosclerosis will be less. The incidences of our atherosclerosis will be less over here. So it is inversely proportional. LDL, it is directly proportional. HDL, it is inversely proportional. High the amount of the high density lipoprotein, less will be the chances for it. So HDL improves the epithelial function. It reduces the oxidization of LDL particle, and the cellular damage is also reduced by the HDL. Types of hyperlipidemia: primary hyperlipidemia and secondary hyperlipidemia. So this hyperlipidemia is due to how it occurs. This types are depending upon how the lipidemia is occurred. So primary hyperlipidemia can be divided into 5 different types: type 1, type 2, type 3, and type 4. Type 1 principally is the deficiency of lipoproteins and elevated chylomicrons and triglycerides. So there is a elevated chylomicrons and triglycerides, and there is a deficiency of lipoprotein and lipids. The degradation of the lipoprotein will be less, and therefore there is a accumulation. Type 2, it is the most common form, and it is due to the dietary factors like mutation of LDL receptor. So what diet you are taking, it depends upon that. Type 3 is high chylomicrons and ideal, which corresponding elevated in the triglycerides. So again, it is related to the high amount of chylomicrons and intermediate density lipoprotein, and therefore there is elevation in triglyceride and LDL. Class 4 is due to the rise in triglyceride level, premature atherosclerosis, and there is a rise in uric acid level. Spleen enlargement is there, and there is a induction by the high fat and carbohydrate diets. This is the reason behind it. Type 5 is similar to that of type 1, that is deficiency of lipase enzyme along with the high triglyceride in addition to the chylomicrons. Whereas these are the primary hyperlipidemia, whereas in the secondary hyperlipidemia, it is not directly related to the lipoproteins over here. It is associated with some underlying disorders. It is not directly related to lipoprotein. So genetic factors are not associated. It is the consequences of underlying disorders like secondary hypolipidemia, diabetes mellitus, hypothyroidism, nephrotic syndrome, biliary cirrhosis, alcoholism, uremia, long-term therapy of oral contraceptive. These are the responsible factors for the occurrence of hyperlipidemia. Elevated triglyceride and moderate rise in LDL is also found in the secondary hyperlipidemia, and there are the chances of atherosclerosis in the secondary hyperlipidemia. So atherosclerosis is nothing but a secondary response to the blood vessels. There is injury to the blood vessels. So injured blood vessels, there is an injury to the epithelial lining, and it is one of the consequences of the hyperlipidemia, whatever the lipidemics are there. So there is accumulation of monocyte and platelets over there, and these are the ultimately leading to the active transport of lipid particles towards the epithelial linings into that area. So there is an invitation of the lipids. So monocytes are converted into macrophages, a bigger size, and they oxidizes this LDL and transported into foam cell, a bigger foam cell. These ultimately contributes for the lipid components and beginning of the atherosclerosis. So formation of the hard and fibrous plug is there, increase in the plug volume, and arterial remolding is taking place over there. So narrowing of the lumen, rupture of that plug will lead to the atheroma and thrombus formation and occlusion of the blood vessels. These complications we are knowing very well. The treatment strategy, principally the treatment, whenever the hyperlipidemic treatment strategy will be aimed to prevent and reduce the complications of the cardiovasculars, lower the therapy, that is reduce the risk towards the cardiovascular disorder, lifestyle modification and dietary regulations. These are the again one of the treatment strategy. Lowering the lipids, so diet rich with the monosaturated and polyunsaturated fatty acid, lowering the LDL level and higher increasing the HDL level. These are the again another strategy for it, and increasing the fiber intake, weight reduction, regular physical exercise, cessation of the smoking. These are the various treatment strategies which are related to the hyperlipidemic conditions. So here we end the first part, and actually what are the various treatments, how these are cured, that will we will see in the second part of it. Thank you very much.